I first got involved in clinical research because of my diagnosis with lupus.
Clinical trial.
Healthcare research.
Clinical trial. From the trial, we could learn valuable information.
I got involved in clinical research fairly early on. I had the urgency of a very aggressive case of MS. And so because of that, I was willing to start working on a medicine that at the time wasn't even on a clinical trial yet. So I went ahead and took like a huge risk. And the medicine that I took a risk on later turned out to go through a clinical trial. And later I entered the clinical trial, and later still. And I went through every single, in a way, every single phase. I watched every single phase of that medicine over years. And I went to the National Institutes of Health every month to get a new dose of the medication. And it worked for me great. And it worked for everyone that I met in the halls great. And so I saw my own MS get arrested. I stopped getting relapses.
Helped me in a lot of different aspects. I would say I got a sense of relief and comfort each month going in and dealing with the staff in the office that I visited. They were very, very supportive, and it was a warm place to go. So it wasn't like a cold place. You go in, they take your blood, they sit you there, and you just feel alone. They made sure that you were comfortable and talked to you. And I really got to know the staff over the course of time that I was there. And ultimately, I would say what I gained was the quality of a life. If I hadn't have done the trial itself, who knows where I would have been if I would have just stuck with the regimen that I was on and not have attacked it as I did and got started feeling better. And I think it instilled in me that, we're going to take this on head on all the way through. And that's what I've done. I think what we do know is if we do nothing, our chances of doing worse increase. So we can do something. And if that something can improve your quality of life and improve your overall health condition, give it a shot. If you think that it can work for you and be beneficial, give it a shot.
I learned a lot from the actual curriculum, and I also learned a lot from, the other participants. I also gained a real sense of not being alone and not feeling as alone.
Becoming involved and directing your energy in a positive way really does feel good. And it can lead to so many other avenues. So I would just say to people, just give it a try, because I guarantee you will not regret it.